The system has definitely stepped up a notch. It's definitely improved. People are more able to communicate.
And it's great to see these mental health services involving the families and the carers.
It's provided unexpected levels of positive feedback to staff, which has had an enormous impact on morale.
It's great because it really adds incredibly, in a very positive way to the outcome.
These people are talking about MH-ECO, Mental Health Experience Co-Design. It's quite a mouthful, but the concept is quite simple. Experience co-design is where people share their experience, knowledge and expertise to redesign a system to make it work better. In this instance, we're talking about mental health and utilising the experiences of consumers and their carers in partnership with service providers.
Previously, there were a number of different ways that changes happened. Often it was staff-driven and staff thinking that they knew what carers or consumers might want and designing things with all good intentions to meet those needs, but really not being informed by what consumers and carers actually thought they needed.
Mental health services have always been consumer focused, but they haven't always listened to what the consumers and their carers have wanted to say.
Myself and probably the other carers had felt quite left out of the whole process. So in fact she said, yes, we're hoping to get carers more involved, and that's certainly what happened throughout the project.
I was very keen, enthusiastic to get involved to improve the PDRSS system, which stands for Psychiatric Disability Rehabilitation Support Service.
We often seek feedback from consumers or from staff, often separately, and not as often from carers, and the MH-ECO was really innovative in that we had all these people in the room at the same time, all talking together, all listening to each other's perspective.
In the experience co-design model, everyone, the consumers, their carers and the professional people delivering the services have an equal voice in how to improve the system.
We already know about carers' needs. There's so much research that goes into carers' needs, and we're aware of that. But this actually follows on that it actually provides an opportunity to do something about those carers' needs. So it's a step further than just researching the needs. It also gives an opportunity to do something about the identified needs.
Originally developed to improve service delivery for large corporations, Experience co-design translates well to any industry where service delivery is the core focus.
Everyone involved really got some sense of what other people's perspectives were and what other people's concerns were. So if you're a consumer, you have particular things you want from the service. Obviously, if you're a carer, there are things you want, and when you're a staff member, there are aspirations you have as a worker.
So how does MH-ECO work? There are 4 steps in the process. Step 1, information gathering. Step 2, training. Step 3, forming the collaborative group. Step 4, working the co-design groups. In Step 1, members of the consumer research team from the Victorian Mental Illness Awareness Council and the carer research team from the Victorian Mental Health Carers Network contacted a large number of consumers and carers and invited them to participate in a telephone survey. At the end of the questionnaire, participants were asked if they would like to participate in interviews and focus groups facilitated by the consumer and carer research teams, with an aim to provide more depth to the survey data.
The surveys were actually carried out by consumer and carers and it wasn't staff-based, so the feeling was that hopefully consumers and carers would feel a lot more comfortable with answering some of those questions, knowing that it was anonymous and that it was not being asked by staff members.
From the responses of consumers and carers to the survey, key issues or touch points were identified, and these became the focus of the redesign process of MH-ECO. Consumers and carers were provided with information on MH-ECO and asked if they would like to participate.
Got a call, I came in, I did the meetings, I spoke with Angela, I was keen, and then they got me onto 3 different MH-ECO groups.
We had about 2 of those meetings before the official project meetings started.
In step 2, consumers and carers are trained in the discussion process, so they will have the level of confidence to contribute equally.
They basically develop skills, like for some people who might be slightly introverted, for some people who might be shy, they were encouraged to be more open, be more confident, and encourage skills to be brought to the table.
And we made sure everyone was comfortable in how to run a meeting, how to be involved in a meeting, making sure everyone participated and you didn't just sit around in the group and not participate.
They were encouraged to present their ideas and they were treated with respect. I was treated with respect, and the confidence just to team build.
I feel it was very empowering for the carers and the consumers and the staff. It was more of a collaborative approach, which is why it was called a collaborative group.
The collaborative group is where the main issues are identified and delegated to a working party or co-design group to analyse and search for solutions.
We took on the project as a quality improvement project. We identified various touch points that we wanted to work on and explore with the group.
People learnt really that those competing interests weren't necessarily at odds, that there were a lot of common ground, and that in fact the process of talking it through came up with really satisfactory and practical ideas.
The co-design groups worked on one issue, examining it from all points of view, then sending their recommendations back to the collaborative group for consideration and probable implementation.
It was fairly intensive. The three groups from memory was carer and family feedback, the other one was complaints process, and the other one was the information process. So each MH ECO group focused on one particular topic.
And I was part of that, putting my carer's point of view forward and quite emphatically sometimes saying, you know, what I thought about things and how things at Rocket weren't the way I would have liked them to be.
Some of the feedback can be challenging for staff to hear at times, but I think that they were really on board with the process.
The staff who work in mental health services want to be doing a good job and want to be contributing to positive outcomes for the people they work with and their families.
Out of this project we actually have some very clear guidelines about what we can do differently that will enhance our service, and we've already started to work on it.
Clearly, MH ECO is an innovative approach to quality improvement in mental health services. It offers opportunities for consumers, carers and staff to work together to make a better health service a reality.
We, I think, got a much better written information and information processes for when people first enter the service, so particularly at the youth residential service.
We've always had family meetings at Rocket, but we're now having, family meetings much more systematically.
We had some brochures, but talking it through really gave us a much better idea around what should be in that, what was missing from it.
The complaints box was really quite obvious and at reception, and people were saying that that's perhaps a little bit too confronting to be able to go up in front of the receptionist to put a complaint or feedback form in there. Plus the box was actually open, so issues about confidentiality, so we were able to address that.
I just think the lines of communication have opened up in a way that it's just sensational.
It was a more united approach, and that tends to flow on to other groups today.
It's certainly something that the Northern Area Mental Health Service will want to continue as the way we approach ongoing service improvement.